Being told you have breast cancer can be a life-altering experience. Tonight, we have Dr. Robert Gardner from Touro Infirmary, who discusses some wonderful health coaching methods that he uses to help the patient focus on wellness rather than illness. Dr. Gardner, thank you so much for being here tonight. You know, obviously October, you're wearing pink. We're all about breast cancer awareness, and I know that Touro has a wonderful program in basically helping women who are going through cancer deal with their emotional, just emotional distress. Can you tell me and give me an overview of the program?
Well, the program at Touro that we have going right now and have had since I've been there and since 2008 is really designed to treat the whole person. That's been a real focus for us at Touro and for other cancer programs around not only New Orleans but around the country. And so psychosocial distress, as you mentioned, is really a manifestation of depression, anxiety. These are very common. I think the statistics point out that fully 1 in 3 people that are diagnosed with cancer experience some form of psychosocial distress, so they meet the criteria for psychological disorder. And so these are because it's so prevalent, it's certainly something we need to address. And people that are experiencing cancer and having depression or anxiety or both, it certainly impacts their health. It definitely impacts the quality of their life, and so it makes just going through cancer treatment and then beyond that much more difficult. Absolutely.
So now when someone is diagnosed with cancer, let's just talk about the team. You know, it's pretty obvious they're going to have the oncology department, and you have infusion centers, you have all of that. But then, you know, with your team, when does your team step in throughout this process to say, hey, I'm diagnosed with cancer and I'm just not at a good place right now?
Yeah, in numerous different ways and different times. What we try to do is assess our patients throughout the process. So obviously when they come into the system, once they're diagnosed, whether it be at Touro Imaging Center or diagnosed somewhere else and comes to Touro, what we do is assess their level of psychosocial distress. And it just as a side note, the Commission on Cancer is making this one of their focus coming in next year. So it's something that you're going to see regularly practiced, not only Touro, but it's certainly in any place someone would be diagnosed or treated for cancer.
Well, I think I'm so happy to hear that, because, you know, I always say to myself when I hear that people have just been diagnosed with cancer, some people actually have to get in their car and go home by themselves. And I just think that it is the loneliest feeling, the scariest feeling, because I've talked to a lot of cancer patients and not everyone has a great support system. You know, so knowing that, you know, both, your team, but also that I guess the whole medical community is embracing a truly mind, body, spirit approach to dealing with cancer, it gives me goosebumps. So please continue. I'm very excited to hear this.
Yeah, I think it actually what it goes back to is in 2007, the Institute on Medicine did a very comprehensive study about cancer care in this country. And what they determined is if you're just treating the disease and not the whole person, that you're missing a big part of providing a good quality level of care. So that was kind of the jumping off point. And so you've seen this growth throughout the country of really making this an emphasis and addressing the psychosocial needs that patients have.
And so now this is during their cancer, I guess, during treatment. What happens post-treatment? Because some people are left with scars, physical scars, and certainly some emotional scars. Tell me about that process.
Yeah, I think one of the things that we recognize is that when someone's being treated, they have specific needs, medically, certainly psychologically and emotionally. As they finish treatment, the medical needs, are addressed. Their physical needs, in some sense, have been addressed. Certainly, the desire is to provide curative treatments, but that's not always possible with cancer. But the psychological and emotional needs, and a whole variety of needs, the family and what their needs are. There's just a variety of different needs that are still present. that don't go away simply because treatment has ended. There have been some studies done that speak to this, and how I think upwards of 60% of people that post-treatment carry at least one supportive care need, so non-medical need, be it depression, anxiety, financial trauma, body image issues, image around sexuality or fertility. I mean, there's a whole host of different needs that are there. So those just don't go away simply because someone's completed treatment. They continue on with them and can actually get worse.
And when it comes to, specifically to women who've suffered from breast cancer, and whether they're going through chemo, whether they've had a mastectomy, I've met so many women, great, amazing stories, but even if they've, been out of treatment or have been cancer-free for 5, 7 years, when they tell me their story, within a 1-minute span, they're happy, they immediately start to cry, then they're happy again, and then it's almost like they have a little sense of peace. But I just feel that pain and anxiety of the diagnosis is always with them, because the minute they start talking about it, they start to cry. But also they cry of tears of joy for the ones who have survived, cancer treatment, and they are survivors. So tell me about survivorship at Touro. Do you have any survivorship programs?
Yes, we do. And we actually just really have developed this in the last several months. Paula Harrelson, who's one of our nurses, chemotherapy nurses, and she's also a breast cancer survivor, has taken this on and has developed this program along with others, myself included. We've all kind of gotten together to help develop this program. And what we're really focused on is giving people information as they transition from treatment into survivorship. There is a lot of times a real sense of loss that people feel when they're finished with treatment. They've been able to get a lot of attention, and they know that the treatments there, are working or helping. And then once that stops, there is this sense of loss.
And I would imagine loss also. Some of them can have a loss of employment, or just that all of a sudden they're left and they have to just pick up the pieces and try to resume a normal life. That must be incredibly difficult.
It is. And
right? How do you go from this trauma of being diagnosed with cancer, then you have to go through some aggressive therapy, treatments, and it's all you think about day in and day out. And I, thank God, don't have cancer, didn't have cancer, but I've been around family members who've had cancer, and it's a roller coaster of emotions. And then, hey, you're done. Go back home, and now let me go back to my job. How does somebody even get back into it?
Well, and that's the thing.
Into daily life, right?
It is an incredible adjustment. What I hear a lot in therapy are men and women telling me how much their lives have changed, and they're trying to kind of catch up with this idea that life has changed. And what I also see is, their loved ones, their family members, their spouse, wants that person to go right back to the way they were, because that's what they know. Yet the patient, in this case, the survivor, recognizes that things can't go back to the way they were. And it's a very difficult transition. I actually see more people post-diagnosis, maybe the first couple of months of treatment, and then after treatment. That's when I see a lot of people, and I really have tried to work with them on helping them deal with the emotions, deal with this transition from treatment to survivorship. Our program at Touro that we've got started, we have an orientation session, so we meet with patients in a small group and talk about the different resources that they may need.
Absolutely. And then also, we can't forget about the caregivers. The caregivers who, whether it's a spouse, a brother, sister, a parent who has to take care of this, the person diagnosed with cancer is exhausted. They're caring for them, and they're just as worried. And do you get them involved in this process? Do you help them as well?
Absolutely. We want the families to feel supported. We want them to feel like their needs are important and are being taken care of. So we definitely do that. I mean, my wife has been diagnosed with cancer. My mother had cancer. My father was recently diagnosed with cancer.
Okay.
So just personally, it's something that's kind of near and dear to my heart. And so taking care of the family is really important. Having been in that role myself,
absolutely,
I recognize just how challenging it is for a caregiver and how helpless they feel. So I think it's really important. So we do have some resources and help for them.
And Dr. Gardner, some words of advice, you know, for those of you who are watching tonight, and if you've been a cancer survivor, or you are diagnosed with cancer and going through treatment, or you're someone who has a family member going through cancer, you know, I think that they need to know that they're not alone and to ask for help, which I think this is something that a lot of people struggle with, because if you went from being an extremely independent person to all of a sudden, I'm not doing well. You know, I'm feeling sorry for myself right now, and I'm mad at the world. You know, what advice can you give anybody watching the show tonight about just being open?
I think you're right. I think that's exactly it. Is being open to
cry if you need to cry.
Let it out. Let your emotions.
Get angry. I tell people, scream.
Right.
Gosh.
I think there's a real need to pay attention to what's going on inside you.
Yes.
You know, I'm not one to give a lot of advice, because I think it's kind of difficult for me to assume or presume that I know what someone else really needs. But what I would say is be a judge of your own needs. Recognize when you are experiencing something that isn't normal for you, do something about it. Do not hesitate. Problems, whether psychological or emotional or any issues around cancer, just don't simply necessarily go away. It takes some time and effort, and make that effort. And then the last thing I'd say is don't let cancer define who you are.
Don't get labeled, right. Absolutely.
Or define your life. It's a part of your life. Recognize it as such, and continue to live your life as best you can.
That's just that was so well said, Dr. Gardner. Okay, so lastly, let's look at the trends. You know, obviously people are finally starting to embrace integrative medicine, which makes me really happy, because I'm a firm believer that if people are taken care of as a whole person rather than just treating a disease, I think they can get healthier faster, and I think their odds go up. Right? And so tell me your thoughts on where we want to go in 5 years from now, 10 years. Is everybody going to be doing integrative medicine?
I think so. You see academic institutions like Duke and Harvard and some others that are really jumping on the bandwagon. They're kind of actually leading the charge.
I love that.
Integrative medicine, I think in medical schools is being taught. There's more an emphasis on not just treating a disease, but treating the whole person. And I think because of that, you're going to continue to see it be a regular part of not only cancer care, but just medical care.
Absolutely. Well, for those of you who want information about Touro and their wonderful cancer care program, you could always go to Touro.com, but also check out their 31 Days of Pink. It's very pink and very fun. Dr. Gardner, you're always just so wonderful to have as a guest. I think the work that you do, the fact that you're touching people's lives in a very special way and making them feel cared for, spiritually, emotionally, is just a wonderful thing. And also you do it with compassion. So thank you so much for being here, as always. All right, we're going to take a quick break, and we're going to be right back.